Do you experience regular but sudden onsets of difficulty in breathing? It's possible that you might be suffering from asthma. But what is asthma? And how do we live with this condition? Hello, science fans! My name is Chana. I'm your resident Filipino scientist, and today we'll look at the science behind asthma. Asthma is a chronic lung disease that makes it harder to move air in and out of your lungs. Asthma is a chronic or lifelong disease. It can in fact start at any age. Asthma runs strongly in families, and half of it is about genetics, and the other half is about environmental factors. It is a type of disease that affects your lungs and its parts where air passes through, which are known as airways. With asthma, the linings of our airways tend to always be in a hypersensitive state, which is red and swollen.
What?
It's similar to how our skin gets red, sensitive, and irritated when we get a sunburn. This hypersensitive state makes our airways react badly to things that we can actually be exposed to regularly, and these are called asthma triggers. And there are so many possible triggers. It could be stress, changes in the weather, dust, pet fur, and so much more. When you are exposed to a trigger, the insides of your airways swell even more. This makes the space for air to move in and out of our lungs smaller. The muscles around our airways can also tighten, and this can make breathing a lot harder. And when that happens, it's called an asthma flare-up, an asthma episode, or an asthma attack. After an asthma flare-up, you will probably feel tired. You're also at greater risk for having another flare-up several days after your initial attack. So, for the days following a flare-up, be sure to 1. Avoid your asthma triggers, 2. Monitor your symptoms, and 3. Make sure you're in touch with your doctor. People with asthma always have some underlying inflammation in the airway that can usually be treated with a combination of quick relief and long-term controller medicines. But some people may not respond well to inhaled medicine, such as corticosteroids and other possible forms of medication. And this could be a sign that they would have severe asthma.
No! God, please, no! 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 No!
Uncontrolled asthma is often defined by the frequency of symptoms, such as daytime asthma symptoms more than twice a week, waking up at night with asthma symptoms more than twice a month, using quick relief medicine for symptoms more than twice a week, and limiting physical activity because of asthma. Having 3 or more of these issues puts you in the uncontrolled or severe category. There are 2 main categories of severe asthma: type 2 inflammation and non-type 2 inflammation. And these categories are based on your response to treatment. Type 2 inflammation includes allergic asthma, which is caused by exposure to allergens such as pollen, pet fur, molds, and other triggers. For these patients, allergens can cause the body to produce immunoglobulin E, which is an antibody that attaches to certain cells and causes them to release chemicals that would create an allergic response. When this happens, common symptoms are sneezing, itchy and watery eyes, severe allergic reactions such as anaphylactic shock, and increased airway sensitivity. Another kind of type 2 inflammation is called eosinophilic asthma. This type of asthma is characterized by the overproduction of eosinophils, a type of white blood cells that helps us fight infections. Now, this doesn't necessarily sound like a bad thing, but for some people, a high number of eosinophils from allergies or parasites can have a negative effect, and it results in inflammation of the airways, which in turn causes asthma symptoms. Now, for an example of a non-type 2 inflammation, we have non-eosinophilic asthma. which can be caused by having high amounts of neutrophils, another type of white blood cell that helps us fight infections. Having too many neutrophils can cause non-type 2 inflammation in the airway, resulting in increased asthma symptoms. Now please take note, this kind of asthma does not respond well to the usual treatment, which is inhaled corticosteroids. And in fact, if you use this kind of medicine, it can even further increase the amount of neutrophils in your body. Neutrophilic asthma is associated with chronic bacterial or viral infections, obesity, smoking, and airway smooth muscle abnormalities. The best way to determine what type of asthma you have and the best way for treatment is to consult your doctor. Approximately 300 million people worldwide currently have asthma, and its prevalence increases by 50% every decade. It causes millions of lost school and work days every year, and it is in fact the third most common cause of hospitalization in children. Sadly, there is no cure for asthma. Now the good news is it can be managed and treated, which means anyone with asthma, like me, can live a normal, healthy life. And so, science has spoken. Asthma is a chronic or lifelong disease that can be serious or even life-threatening. It is caused by genetics or environmental factors that lead to the inflammation of airways in your lungs. These can be triggered by dust, pet fur, smoke, pollen, medicine, and so much more. There are two types of severe asthma, which are type 2 inflammation caused by immunoglobulin E and eosinophils, and non-type 2 inflammation, which can be caused by neutrophils. The different types would need different forms of treatment, and so it would be best for you to consult with your doctor to find the perfect treatment plan. Poor asthma management can lead to airway remodeling. Airway remodeling is a serious condition that happens when asthma is untreated or poorly managed. The lungs become scarred, asthma medicines do not work as well, and less air is able to move through your airways. But airway remodeling does not have to happen. All you have to do is to work regularly with your doctor to figure out the best treatment plan for you. But what do you think? How many of our science fans have asthma or know someone who does? Do you have any special techniques to avoid flare-ups? Please share your thoughts and ideas in the comments section below. And for a daily dose of science goodness, please follow our social media channels and visit our website also. Thank you very much for joining us today, and I hope to see you around.